So I want to thank everybody for being here today to hear this presentation. We're very excited about the Grass Valley free 2-day healthcare clinic that's happening January 11th and 12th at the Nevada County Fairgrounds. It's being put on by California Care Force, and it's hosted by the United Way of Nevada County. So I'm sure most of you are aware that there are many people who are still falling through our healthcare gaps and aren't able to receive basic health care, especially dental and vision. Even if you have insurance or if you're on Medicare, often dental and vision are not covered. And that's where the Care Force comes in. They're a nonprofit that's based in Roseville, and they put on mobile free clinics that cover medical, dental, and vision care. They have all the necessary equipment. You see a pantograph machine here, so you can get a complete set of x-rays. We also are going to be setting up 60 dental chairs that's complete with water and suction, just like in the dentist's office. And in those chairs, people can get cleanings, fillings, some reconstruction, some tooth reconstruction, and of course extractions. So since 2011, over 13,000 volunteers have provided healthcare services to over 29,000 individuals, delivering almost $12 million worth of care through their California clinics. The United Way of Nevada County focuses based on the basic needs of Nevada County residents. That includes food insecurity, emergency shelter, and access to health care. So it's a natural that the United Way and the California Care Force should join forces to bring us this 2-day clinic to Nevada County. Now, I want to make sure that everybody knows this is a free healthcare clinic that is open to everyone, no questions asked. And in 2015, we had a California Care Force clinic at the Vets Hall in Grass Valley, where we served over 550 patients with about $250,000 worth of services. Here's a panorama of the Vets Hall, and we set up 30 dental chairs at the Vets Hall. So now in 2020, we're hoping to serve twice as many people, about 1,000 people. And the reason for that is our venue, being the Nevada County Fairgrounds, will be able to set up over 60 dental chairs. It takes about 2 days to set up a clinic like this. And another reason why we're going to be able to help more people this time is the last time patients had to come at about 3:30 in the morning and wait online to get a number. And that was really hard for a lot of people without knowing. There was no guarantee that they were going to be able to be seen. And so we know that a lot of people didn't come because of that. So the California Care Force came up with this new system. It's a wristband system. And you can come the day before. For instance, if you want to be seen on Saturday, you come on Friday. Starting at noon, wristbands will be put on people who want services. You can specify the service you want and the time slot you want, and then the next day when you come in at the right time, you will be guaranteed to be served. So we're really hoping that that helps people out a lot. And then of course the United Way being part of the host group. You know, there are two components to these clinics. There's the California Care Force, who actually brings the equipment and provides the services, but there's the community host group, which is the United Way, and we prepare everything before the clinic. So we're in charge of a lot of things, which I will cover. One of the ways that we want to reach our goal to serve 1,000 people is getting sponsors to fund and to get professional healthcare providers to volunteer. That postcard that you see, I'd like to explain that postcard. Last time when we were trying to reach out to the dentist and to the eye doctors, all we could do was leave a brochure at the desk. And we never knew if the actual healthcare providers were getting this information. And we could have used more healthcare provider volunteers. So this time what we're asking everybody to do, this is something that you can do to really help the success of this clinic, is to have that postcard with you when you go see your dentist the next time. When you go see your eye doctor the next time, have one for them too. And after your service, before you pay the bill, give them the card and say, you know, this is a real gift to the community. I hope that you will volunteer. That's really going to help us. So let me just briefly describe what's available at the clinic. First, the medical portion of the clinic. People can come and get blood pressure tested. In fact, everybody will get their blood pressure tested, because if they go on for dental, they want to make sure their blood pressure is in control. They get diabetes screenings, prescriptions can be written, immunizations will be available, and we plan on connecting with local clinics to be able to provide follow-up service for the things that we can't accomplish at the clinic. So dental, which is really the biggest part of our clinic. You saw the full pantograph machine for x-rays. You're going to get dental cleaning, fillings, extractions, and I think I covered that already, but there it is again. In vision. Now, I happen to volunteer a lot in the vision department, so I can give you a pretty good description of what goes on there. When a patient comes in, they get a complete eye exam and they'll get tested for glaucoma. They'll also get a prescription that is theirs to keep. That prescription is worth over $100, because they can go into any eye place and get a pair of glasses without having to take an eye exam. They get their prescription, then they go over to some tables with brand new designer glasses. I mean, these are all donated frames that they can pick the frame that they like, and then they take their script and their frame and they go over to another department where their glasses will be ground on site. They can grind 250 brand new pairs of glasses each day. They can even now do bifocals, which before they weren't able to do. And if there's a prescription that they can't fill, they work with a vision company that will make the glasses in their place and then send it to the patient after the clinic. So it's a great service. United Way is asking everybody, this is going to take the whole community being involved. We have lots of things to do, including fundraising and volunteering. Fundraising. A clinic like this costs about $60,000. Now, the Care Force is getting some grant funding, but they expect us to make up the difference. I'm happy to say that at this point, now we've been working on this for about over a year now, and we're halfway there to our goals, but we still have another $30,000 to raise. And just so you know, every dollar donated results in $20 worth of health care. How can you help in that regard? Well, you can become a sponsor. Right now, California Care Force has this new sponsorship for individuals. You can sponsor a dental chair for $250. And what that contributes is, in that dental chair, anywhere from 9 to 15 people will be served with up to $9,000 worth of services. And then as a sponsor, you get a little plaque that gets hung up on the sponsor wall, and also a little sign on the dental chair that says, "This is the dental chair that I sponsored." You can make a tax-deductible donation, which I will tell you how to in a little bit. If you want to have a garage sale and advertise it as a fundraiser for the clinic, there's lots of ways that one can raise money. Also, donating food for volunteer meals. We're responsible for supplying the breakfast and lunch for all the volunteers at the clinic. And medical supplies, about a third of that $60,000 goes to medical supplies. So another thing that the medical professionals can do for us is maybe donate medical supplies and help us cut those costs. So how to donate? We make it very simple. What you would do is you would go on the United Way of Nevada County website. That's uwnc.org. And on their homepage on the right side gives you information about the healthcare clinic and a little yellow button that says donate. So when you press on that button, there's a page that comes up that you can do through PayPal or a credit card. But what it says on this page is this is for the healthcare clinic. That way you know all your money that you're donating is going to that. I want you to know that United Way doesn't take any money out of this. In fact, they're going to be donating money to this too. Of course, you can also send a check to them made out to United Way of Nevada County, and do put in the memo line that it's for the healthcare clinic. Another way to help us is to spread the word. Our responsibilities are to get those healthcare providers, and so I hope you use those cards. Another way that we're getting the word out is presenting to organizations like you guys. And if you belong to any other organizations that you think would like to hear about this, let us know and we'll set up a presentation. I've been presenting to churches and businesses. We do have a little donate box for the clinic, and if you know somebody that has a business that would like to put that up by their cash register, we can do that. And then later on, as the date of the clinic approaches, certainly getting the words out to family and friends to either volunteer, or if you know people who need our services, let them know that we're around. So, to volunteer. We do need our healthcare professionals, but we also need general volunteers. All you guys could volunteer at something like this. We need volunteers to register the patients, to register the volunteers. We need being able to escort patients from one part of the clinic to the other. The way this is set up at the fairgrounds is the main building will be our dental portion, and then the northern mines will be vision, medical, and registration. And so there'll be lots of people going back and forth between those two buildings, and patients are real, a lot of these people, they're going to go see their dentist. They haven't seen a dentist in 15 years, and some of these people need 20 extractions. They're very nervous. And so having somebody help them, give them support as they're escorting them is a great service. We also need setup. Remember I mentioned we have 2 days of setup. So if you know of any strong young bodies, we could use that. And of course, tear down too. We need interpreters, and we also could use help with serving the volunteers the food that we have to prepare for them. So this is a list of the very professionals that we need. But I wanted to point out this picture to the right here. It's volunteer registration, and if you notice on the back table, there are stacks and stacks of t-shirts. Those are t-shirts for the volunteers. When we have a clinic, we design and get printed out our volunteers for our t-shirts for all the volunteers, and that way at the clinic when patients need help, it's easy to spot somebody who's volunteering. The other purpose for these t-shirts is on the back of the t-shirt we print all the different groups and individuals and businesses that have helped us with this, and then for the volunteers themselves it's a great souvenir to take home and remember this great event that they were part of. So, to volunteer, you would also go to the United Way website, uwnc.org. The reason for this is, for some reason, the Care Force does not open their registration until 2 months before the clinic, but we wanted people to have more time to sign up, and especially the healthcare professionals. So the United Way has put up on their website, underneath the donate button, it says click here to volunteer, and when you click there a form will come up and you can fill out the form, and that way you're registered to volunteer, and that's how your dentist and your eye doctor would do it. So I just wanted to end this with a thought. It's a quote from a man named Rustin Bayard. He was Martin Luther King's one of his advisors, and his quote is, "Action is the proof that one truly believes is in action. And so here at CareForce and United Way, we truly believe that in a society as ours, everyone's entitled to basic health care. And so our action is to put on this clinic. And we invite you to join us in this action. Together, we can all make a difference.